So let's talk for a second about breast reconstruction using implants and radiation. So radiation is an adjunctive therapy that we use sometimes with breast cancer patients. And often when patients have mastectomy, it then leads to a situation where they don't need radiation, but that's not always the case. Sometimes patients still do. Traditionally, when patients were going to have radiation, we would tell them that they couldn't have a breast reconstruction using implants, but that just isn't the case anymore, and we do this all the time. So the main reason we would tell patients that they can't have an implant with radiation is because fear of capsular contracture. And some of the older studies showed very high rates of contracture with patients that had radiation. But how we do things now, we just don't see it very frequently. So I have patients with implant-based reconstructions all the time that are radiated, and it's extremely infrequent that I see patients with contractures afterwards, which is great. So in general, what I see in my practice when my patients have radiation is that the side of the radiation feels a touch more firm. It often looks exactly the same. And we can improve the feel of that tissue by doing fat grafting later. So we usually let the patient recover from radiation for about 6 months and then come back later and bring some healthy tissue into the area with fat grafting. There's also some things we can do during radiation to try to minimize the chance that you develop stiffening or a lot of stiffening of the tissue. So the first thing we do is we like to recommend topical antioxidants to the skin to help protect the skin during radiation. A lot of radiation doctors will recommend vitamin E capsules. They just don't work very well. There's better antioxidants on the market, so I usually recommend that my patients use some of the ones that are made for the face, and they use that on the skin of the chest during radiation. And then there's also a medication that we use that minimizes fibrosis or firm tissue forming from radiation, and that medication is called Trentol. So I have patients that have implant-based reconstructions that get radiation all the time, and we very rarely have problems. So it's absolutely still an option for patients that are having radiation. Traditionally, yes, there was high rates of contracture. We just don't see that currently with how we do reconstructions, and I think it should still be an option for all patients that are having breast reconstruction with or without radiation.